Presenting Dragonfly, Remote Patient Monitoring. Dragonfly allows value-based care organizations to remotely monitor patients with chronic diseases to ensure that the patient's conditions are not deteriorating. To begin, the provider must order a care plan in the EHR. For this example, let's call him Dr. Kottman. Dr. Kottman searches for the desired self-management plan, in this case, congestive heart failure. Within the order details, Dragonfly self-management care plans utilize clinical questions to set patient goals and customize alert levels. Alert notifications will be created should the patient record a measure out of range. For this example, an alert will be generated when the patient's systolic blood pressure is greater than 140 and less than 90. Once the order is in the patient's chart, they'll be provided with a personalized set of simple instructions to use for downloading the mobile application. The patient uses their unique registration code to enroll in the provider-prescribed self-management plan. Once the order is in the EHR, it will be pushed to the Dragonfly Management Coordinator. The patient can now download and enroll in the mobile application on their smartphone. Once it's downloaded, the patient will begin receiving automated reminders to check and record the relevant measures throughout the day. In the mobile app, the patient can begin recording their data. To record, the patient selects the required measure, in this case blood pressure, and enters their data. When they hit save, Dragonfly will prompt them to the next required value. Once the patient saves their values, the information is passed back to the Dragonfly Management Coordinator and then pushed into the patient's chart in the EHR. Dr. Kottman can now review the values without ever having to leave the EHR. Aside from recording data, the mobile application can also be an educational resource. By selecting the Learn tab, the patient can review information related to the symptoms and management of their chronic disease. Scrolling down, the patient sees visual data that gives them an idea of where their values fall within relation to the threshold set by Dr. Kottman. You can see here that the patient's systolic blood pressure has fallen higher than the recommended threshold. Dragonfly recognizes that the blood pressure is off, and a warning sign is sent to the care team within the EHR. When viewing the task list, the care team identifies that an urgent task has been generated as a notification of an abnormal patient value. While most EHRs have some type of tasking mechanism, Galen can translate the Dragonfly alert into the appropriate communication mechanism for your preferred EHR. The clinical staff can now navigate to the patient's chart to review the patient's reported data. You can see here that any abnormalities are colored red. There are also visual indicators on the left-hand side of the page. Dr. Kottman's care team can now contact the patient to perform the appropriate intervention. Dragonfly, Remote Patient Monitoring, enabling providers to keep track of patient needs at a faster rate and ultimately improving the quality of patient care.